experiencing a special kind of chronic pain, you might not know what it is, and it could be fibromyalgia. Please welcome Dr. Bryce Wylde with some things you want to look out for, some treatments out there. It is so painful if you are going through it, but you know, I hear this from women. Some doctors dismiss it. And it's difficult to diagnose. So let's first start with what is it?
It really is. You know, for so long now, it's been a diagnosis of exclusion, which ultimately for a doctor, which, by the way, I'm not a medical doctor.
Yes.
I'm a natural health care advocate and practitioner. So we differ in many ways, but have now nicely come together as it relates to fibromyalgia, I feel.
Yeah.
And so because fibromyalgia is sort of like a tick off, you don't have this, you don't have this, you don't have this, but you possibly, yeah, you possibly could have. The unfortunate reality is still a lot of doctors out there as well who also suggest, and through dismissal, that it's hypochondria. It's all in your mind, or it's maybe just depression, for which a lot of fibromyalgic people actually experience. So let's go through. What is it?
Yeah,
ultimately, we define this as a confused central nervous system, which leads to body-wide musculoskeletal pain. This person is in chronic pain, day and night.
Well,
and in fact, there are some specific pressure points. Okay, so the individual and the doctor knows this by looking at these specific pressure points on the body: neck, top of the shoulders, elbows, these areas where the muscles insert themselves around the knee area. These areas are significantly, worsened at specific times of the day after exercise, first thing in the morning, and that's how a doctor might ultimately know. These people, unfortunately, also have depression. They have joint pain in the face, so facial pain.
Ouch.
They have stomach issues a lot of the time. These people have anxiety. They have sleeplessness. They have memory issues and forgetfulness. So it's a whole slew of problems. What I want to get across is there's actually ways in which we can treat these individuals both naturally and sometimes even conventionally. So drugs such as Lyrica, I'm not opposed to if and when you need to and you have a good diagnosis. But let's start about diet and things that we should really avoid. Now, what we know,
I feel like you're going to go there with that.
You know,
cut that out of the diet, right?
Absolutely. Cut this. Well, we should all be cutting this stuff out, really, at the end of the day. But for somebody with fibromyalgia, here's why these individual items are worse. Sugar just causes inflammation. Straight across the board. For fibromyalgia or anyone with any sort of inflammatory condition, we know that, in particular refined sugar. There was just recently in the Journal of Rheumatology, April 2014, flour, gluten, anything that's pastry, cakes, cookies, you know, flour and gluten found in wheat can actually seemingly cause a significant worsening of symptoms for the fibromyalgic patient.
You feel like it hurts more.
You are in so much more pain. So pain scaling, precisely, bingo. And then there are things like aspartame and, you know, of course, the bad fats, but MSG, which is still found in so many soup mixes, and nitrates, and nitrites found in meats and preserved meats. These things trigger a receptor, which is a pain receptor in anyone, called the NMDA. And in a fibromyalgic individual, the NMDA receptor sites are hyperfired. So these people feel pain already more than the average person. You ditch that stuff, you're far better off.
Okay, because that's going to exacerbate your pain.
Absolutely.
Now, people would look at this and say, these are the good things, right?
Wouldn't they? Brightly colored fruit, vegetables, and, you know, most of us should be eating more of this on a daily basis. These are all a part of what's called the nightshade family. Okay? So it's paprika, tomatoes, potatoes, bell peppers, all of them, all colors, and eggplant. You need to kick all of these out if you think you have fibromyalgia, or by the way, rheumatism for that matter. And then slowly what I want you to do after a couple of months is bring one in at a time and then ditch it again. See if that actually has an impact. Because if it does, you want to get rid of them for good.
What are those doing? Are they doing the same thing those are doing?
Excellent question. So these are more chemical. These are much more allergenic, by the way. So allergenic meaning the immune system, because this is possibly also immunologic, not just a confused central nervous system, but possibly fired up because of an immune imbalance, almost like an autoimmune type scenario. Although we haven't proven inflammation is at the root issue, we can definitely help to quell inflammation by kicking these things out.
Interesting. Now let's talk about treatment options out there.
There's so many options. What I'd like to get across is we want to individualize the patient. So in my patient basis, some patients might be on these supplements, others these, or others a mixture of all of them. Each of them do different things. So another issue with fibromyalgia is that the deep layer of every single cell in your body, there's something called the mitochondria. The mitochondria makes energy for you. The currency of energy is ATP. Remember that? Yeah. Biology, you know, grade 11, we all learn this stuff. So ribose, and in fact D-ribose, something in this product here, helps to fire up and give that person more cellular energy. SAMe, which is excellent for general pain, specifically joint pain, but also helps the liver detoxify. Interestingly enough, it's a sulfur donor that also helps individuals that have a deficiency in this stuff.
Okay.
Chlorella, a really great study, actually a randomized placebo-controlled study done on chlorella, seems to actually reduce the pain of the fibromyalgic individual. So that's interesting.
That's excellent.
Get your essential fatty acids into you in the form of fish oils, because that seems to help individuals with fibromyalgia. And then I really like to recommend magnesium, in particular a form called bisglycinate. Across the board, that is something that can help almost everyone with fibromyalgia. If you want to get proper treatment, though, what I need you to do, whether it's a medical doctor or somebody like myself, you need to look for a functional medicine practitioner.
Okay.
That type of practitioner is going to be the individual who's going to look at you head to toe holistically, consider the diagnosis of fibromyalgia, but also really seek out underlying cause. Is it chemical? Is it immunologic, allergenic?
Right.
Is it mind-body? Because this is upset, they get worse as well. Stress is the #1 North American-wide silent killer. We have to learn ways to meditate better, more often, mitigate that stress. And you know, another thing about fibromyalgia, and chronic fatigue, by the way, which are kind of similar, we're always in our heads in a clinical setting, is it CFS or is it FMS? Another thing is you need to exercise, but you need to be moderate and consistent.
Right.
You need to de-stress and not have too much or too little. You need to be moderate and consistent.
So you have to do it constantly, and it should be at a moderate rate.
Bingo.
It's got to be something that reoccurs, though, again and again.
Because even if you feel a little poorly that day, you still got to hit the gym and do what you know is not going to make you hurt. If you feel great, you do not overdo it, because that will indefinitely make you feel so much worse.
Got it. So everybody's got an individual case, and as you say, you really have to go for somebody that is going to focus on your functional health, and they are going to give you what you need in terms of treatment, right? Whatever combination, but don't try and figure it out on your own. No, you know, that's what I do at P3 Health here in Toronto with an internist, Dr. Tim Cook, and a whole slew of experts, Sam Gibbs, osteopath, we have naturopaths, of course, chiropractor. We come together as a team for these patients, absolutely. Test them functionally, what's going on in you right now, immunologically, inflammatory, you know, and even genetic. And then and this is what's really the beauty of this kind of integrative clinic, is we focus on not just the individual, but the individual's malpractices and getting them better in tune with mind-body. So one of our focuses is mindfulness-based stress reduction. Okay. And if you get into that as a fibromyalgia patient, conclusive studies, placebo-controlled studies show that this actually favors the individual with an inflammatory immunological imbalance. I think we could all use that that kind of practice, right?
We all should.
We need to decrease our stress. Okay, great information. Thank you, Bryce. Let's go to break. Stay with us. More coming up.